Hey guys, Kati Kleber here and Tosh Kleber apparently back there. I want to do a quick video on just some tips and tricks for being a newer nurse in the Neuro ICU world. So some things, quick tips, heavy hitters: do your first neuro assessment with the previous nurse. Really helps because if they're communicating these specific changes, or this is a neuro assessment, and then you go in and you assess the patient 20 minutes later after the nurse has left and it's different, then you can quickly say, if they're with you, hey, is this consistent with what you got? It's not what you said, but is this what you've been doing? I've had that happen, a bunch of times myself doing that, or another nurse where it's like, oh wait, no, I meant to tell you this. Oh, I'm sorry, that was a different neuro assessment at a different point in the shift. So completing your assessment with the previous nurse is a great idea. Another thing that is very helpful is if the neurosurgeon or neurologist or any physician is at the bedside and doing an assessment, and they're doing a neuro assessment, pop in their room with them and do it with them. That way the patient doesn't have to go through it again shortly thereafter if you had to. Consolidates times where they're having to go through another assessment, and it really helps the patient, and then it's one less thing you have to do. Really, really helpful. Always know what your sodium is. Really important. Sodium is important to neurosurgeons and neurologists like the potassium is and the magnesium is to the cardiologists and the cardiovascular surgeons. So know your sodium. Know propofol, 3% or hypertonic saline. Mannitol is really important. What other neuromeds? The anti-epileptics are really important. You'll have patients that are having seizures, and what kind of interventions would I do for someone with seizures? So that's really important too. So those are some meds I encourage you to check up on. I'll put a link at this video for 3 common neuro ICU meds that I go a little bit into depth on. I really encourage you, while you're learning how to do assessments, do them systematically, same way every time. Start with level of consciousness, then go from the eyes down and then to the extremities. If you go here, you're going to forget something. And it's especially if your patient is on propofol and you have to pause the propofol to let it wear off to get an assessment, and then you put them back under. If you forget a couple aspects of that neuro exam, you're screwed because you have to pause the propofol again. So it's really important to maximize that time and make sure you're systematic with your assessments. So clustering care is really important, especially if your patient is, one of those patients on propofol or sedation, and you have to pause the sedation to get an assessment. So making sure that you're clustering care and, consolidating tasks as much as possible is really, really helpful. And sometimes you really have to think about, is it worth right now, my patient with severely increased ICP, to do a bed bath, to do these kind of, technically the patient should be turned right now, or should I wait until I know that they're farther under, and maybe I should just slide a pillow under a hip to offset their hips for this time, and then we'll do a bigger turn in a couple more hours. It's really important to consider that kind of stuff, especially with patients severely compromised intracerebral pressure. So that's really important. One of the biggest things with neuro assessments and neuro is knowing when there's been a change, because some patients are very inconsistent with their exams. So there's a difference between someone that is inconsistent and someone that is consistently inconsistent. So if I'm doing an assessment on someone and all of a sudden, they were saying their name before and now they're not, I'm not going to pick up the phone and call the physician right away. I'm going to wait a little bit and then ask again and see if this is consistent, or if maybe this time they forgot something, but next time they'll remember it. So it's really important. Patterns and trends are really important with neuro patients because they're all so dynamic and different. So make sure that you're paying attention to that. One really big thing is the first sign of intracranial pressure changes is a level of consciousness. So, patients in the neuro ICU get woken up every hour, every 2 hours. And if you're waking them up and they're not waking up, but you're like, oh, they're probably just tired. The way that you can tell if they're just tired or not, and it's really important that you know this, is if you flip on all the lights, you pull back the sheets, you're using painful stimuli, you're doing yada, 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 and they're still not waking up, that's an issue. And that's something that needs to be called to the physician if that's a new finding, because something in their brain is changing when they're not waking up. And you know, even if someone is really sleepy and really tired and grouchy, if you flip on the lights, pull down the blanket, yell their name, do some trap pinches or, you know, some nail bed pressure, and they're still not waking up, that is a problem. But if you're going in there like, hey, wake up, and they're not moving around or whatever, try harder, be louder, use painful stimuli if you need to, because it's really important to know if they're responsive or not. So that's really important. Level of consciousness, I cannot begin to tell you how important it is. So if you're waiting on patients sedated, but you're waiting for pupillary changes or massive changes in the differences between, you know, maybe this hand, maybe they're both equal, but if the one hand's weak is when you're going to start worrying, you're missing big things and you cannot get brain cells back. So it's really, really important that you're paying close attention to level of consciousness and not just vital signs and not just pupils and hand grips and toe wiggles. There's so much more to a neuro assessment, and the main thing is that level of consciousness. So that's my tips. One more, I really think it's really helpful when you have a pen light that attaches to your badge. Really helpful because you never forget one when you go into a room. And it's a little weird tip, but I have mine on my badge. It's wonderful. So I don't want us to be too long, but I just want to give you some heavy hitters that are just little tips. So Tosh and I thank you for watching, and I have a couple links posted at the bottom of this video just for more neuro-y kind of info if you're interested in neuro, interviewing for neuro, or new to neuro. Thanks, guys.